Welcome to Talk Politics. I'm Ken Rockburn. Coming up on our program tonight, after a couple of years of testimony and investigation, the Senate releases its report on the state of the healthcare system in this country. We're going to have a reaction to the report of Michael Kirby from the Canadian Health Coalition. That's in just a few minutes. And then after that, we'll talk to the chair of that committee, Senator Michael Kirby himself, about the contents of the report. We'll also examine the status of women in the Islamic world, and journalist John Bentley Mays will be in to talk about his new book on the settlement of Ontario. All of that just ahead on Talk Politics. Don't go away. Well, as I said, we are going to be talking about the Senate report on health care, the so-called Kirby report. The Senator Michael Kirby will join us in a little while. But first, the Canadian Health Coalition was quick to respond to Senator Kirby's report, so quick, in fact, that its national coordinator dismissed it pretty much the day before it was released. And when it was released, the coalition said, and I'm quoting here from a statement they released, "The report released today is based on the premise that health care is a commodity to be bought and sold." Michael McBane is the national coordinator of the Canadian Health Coalition. He is with me to start things off. Welcome.
Thank you, Ken.
Now, this is, there's been some fairly heated back and forth over this one, and I guess we should deal with one of the issues that the coalition has raised a number of times about this particular Senate report and about its chair, Senator Kirby, because there have been editorials. We know there was one in the Ottawa Citizen just today about this. You have, when I say you, I mean the coalition, has said that Senator Kirby shouldn't be part of this at all because he is in a conflict of interest situation. Why is that?
Right. Well, we're using that in a very technical way, and we're judging his position in terms of the Code of Ethics, Conflict of Interest Code of Ethics for public office holders. We're not just using that term in general. We're being very specific, and we're judging his situation in light of this code. And he violates two principles, 3 and 4. Principle 3 says no public office holder will use his public position to further business interests that he holds. And clearly, Senator Kirby is pursuing a policy course, which is commercialization and private home care in particular, that would benefit directly his company. That is, technically speaking, a conflict of interest as defined by the Conflict of Interest Code. And so the editorial in the Citizen, for example, today doesn't actually understand what a conflict of interest code is.
The editorial, and I'll get you to respond to that too, suggested, as other people have, that if Senator Kirby is conflicted on this, then why isn't Wilbert Keon? Because he is the head of the Ottawa Heart Institute. Why wouldn't he be in favor of, support for that end of medicine? And they went on to list all the other people on the committee and what
Right.
their... And then talked about your coalition and the number of groups, labor groups and so on, that are connected to this coalition, and why are they any different from you?
Right, and they said that Romano is in a conflict because he's a former NDP premier. It's an illustration that the editorial writers don't understand what a conflict of interest is. Conflict of interest is a specific technical term, and it pertains to a financial conflict of interest. No other senators that I know of have a financial conflict of interest on the committee. There is bias in some of the other senators in terms of the two physicians. We believe they're biased in favor of commercial medicine. But that's not a financial conflict of interest, because as far as we know, they're not personally invested or don't sit on the boards of health industries. Senator Kirby does. He sits on several health industries. So we're using the term in a technical way as defined by the Code of Public Office Holders. None of us are public office holders, and none of us have financial investments. We are not, therefore, in a financial conflict of interest. Neither is Commissioner Romano. And so that's why we would hope that people would look at what conflict of interest is. That's part of the problem in Ottawa today. We think that there's basically a moral vacuum. Václav Havel talks about a morally contaminated environment. People don't even know what conflict of interest is in Ottawa.
All right, let's talk about some of the things that are in the report then. They call for, among other things, we'll talk about a couple of them here, this idea of having a health care commissioner. What do you think of that idea?
Well, that's an idea that came up in the Romano Commission, and we think it's a good idea because has become evident in many ways, including the reports of the Auditor General. The system is run on autopilot, and there's nobody in charge, and there's nobody overseeing it. The federal government has abdicated its role as the guardian, and clearly we need that function being played, and Health Commissioner is probably a good idea.
Would it not be better to somehow ensure that the cabinet minister responsible for health would be the person doing that? I mean, isn't that the way it's supposed to work?
Yes, the federal minister of health has judicial obligations and legislative duties that she's not upholding, and it's been several years that ministers of health federally have abdicated their responsibilities to enforce the Canada Health Act strictly and proactively.
So why would a commissioner be any different then? If the federal minister in charge of this can abdicate that responsibility, what good is a commissioner going to be?
Well, it could be modeled on the privacy commissioner, who does a good job because he's independent. He's got some resources and investigative capacities separate from the department. The department, in a sense, is a conflict of interest. They're not going to report on themselves. Whereas an outside commissioner who has a really good mandate, of course the key is in the detail, but if it's a public interest mandate where people can go to this commissioner and report violations, then I think that's a better step towards more transparency and accountability.
One of the other things that they've recommended is, and I can't remember the exact phrase, I think it's the healthcare guarantee, I think is what they call it.
Yes.
Where they are suggesting that if you have to wait too long for a particular medical procedure that the government is going to pay for through a Medicare program, if you have to wait beyond a certain period of time, you have then the right to go and have it done wherever you want, anywhere else in the country, anywhere else in your community, or anywhere else in the world, frankly, and that the money would have to follow you. In other words, the government would have to pay for you to go and have that done because you are entitled to having that procedure done within a certain period of time. Do you see problems with that?
Major problems.
What are the major problems?
Well, first of all, where is the incentive for someone like Senator Kirby, who is selling private health care, to make sure that there's no public waiting list? We've seen a manufactured waiting list in Calgary, which is really the headquarters of healthcare privatization, in order to create a private market to sell cataract surgery, to sell MRIs. They're manufacturing a wait by deliberately denying public access. And so this makes it easy. It's like a Trojan horse. But you know, we're not dealing with pizza. 30 minutes or free pizza. Healthcare isn't like that. It's much more complicated. You don't shop around for brain surgery. You know, that's why I say they're treating it like it's a commodity to be bought and sold. And they want the same kind of consumer guarantees as you'd have in fast food. That's a complete misunderstanding of how healthcare services need to be delivered. And where's the commitment to make sure the public waiting lines are lowered and are not too long? You see, if there was just a little bit more concern about fixing the public system and less threats about setting up a private parallel system, which they personally are invested in, that would have more credibility.
Do you think that there was a bias on this Senate committee towards having a private system?
Absolutely, and we've identified at least 7 chapters in the text. Like, we're not just talking about a personality conflict here. We've analyzed the content. The biggest one that we saw right from get-go in the report is it says it doesn't matter who owns the services, doesn't matter to the patient, doesn't matter to the funder. Well, you know what? That's a big lie. It matters because this is a real central policy issue. It's been studied and researched. The research has been published in peer-reviewed journals, linked on our website, and it clearly demonstrates across the board that for-profit hospitals have a higher death rate. So we would predict more than 2,000 deaths in Canada. This is according to the study published in the Canadian Medical Association Journal this year. More than 2,000 Canadians would die if our hospitals went for profit. And to say that it doesn't matter, the other evidence, of course, shows that it's more expensive and that it's less equitable and much more inefficient. That's clearly the American example. American experience. We brought in an American expert, Dr. Arnold Relman. And
yes,
your viewers,
about him. He came on this program, actually.
Yes, your viewers had seen him and heard his powerful expert witness testimony, all peer-reviewed. And Relman has clearly demonstrated that bringing in a private system, bringing in the market will increase inefficiencies and increase cost and jeopardize the quality of your care.
But they make the argument in the final report, in which they quote Dr. Relman at least twice, though I gather that in previous reports he was not mentioned at all, but nonetheless he is mentioned in the final one. I went through it and made sure that he was. They refute him